Have you noticed that your erections are not as firm as they used to be, or that you sometimes experience a little urine leakage after using the bathroom? Before you assume it's simply part of getting older, there's something important you should know. In many cases, the muscles surrounding your hips and pelvic floor gradually become tight, weak, and less responsive because of long hours spent sitting, limited movement, or everyday habits that slowly reduce flexibility over time. The encouraging news is that you can begin improving how these muscles function with a few simple stretches that require no special equipment and only a few minutes each day. In today's video, I'm going to guide you through 5 carefully selected stretches that may help improve flexibility around the hips and pelvic floor, encourage healthier blood flow, and support better bladder control while also helping create the conditions for stronger, longer-lasting erections. Stay with me until the end because I'll also walk you through the complete routine so you can easily repeat it on your own whenever it fits into your schedule. Let's get started with the very first stretch. Our first movement focuses on opening the hips, and although it may seem simple, it's one of the most valuable places to begin. The hip joints sit very close to the pelvic floor, so when the muscles around the hips become stiff, they can influence how comfortably and efficiently the muscles below function as well. If you spend much of your day working at a desk, driving, or simply sitting for long periods, there's a good chance these tissues have become tighter than you realize. Find a comfortable seated position on the floor with both knees bent. If you have a wall behind you, use it for support. If not, simply place both hands behind you to help maintain balance throughout the exercise. We'll perform this movement for about 40 seconds. As you settle into position, begin by slowly rotating one leg inward while allowing your body to follow naturally. Then move smoothly toward the opposite side. There is no need to rush this exercise. Slow, controlled movement allows the joints and surrounding muscles to relax much more effectively. As you rotate, you may notice a little stiffness or even some gentle clicking inside the hips. That can happen when joints haven't been moving through their full range recently, but you should never feel sharp pain. Listen carefully to your body throughout the movement. As one leg rotates inward, allow your upper body to turn slightly away from that leg. This creates a deeper but comfortable stretch through the inside of the thigh, around the hip joint, and even across the outer hip muscles. Continue breathing normally as you move. With each repetition, you may notice your hips beginning to loosen. As that happens, you might naturally be able to rotate a little farther than when you first started. Let your feet remain about shoulder width apart while gently shifting your weight through your heels. As the final few seconds pass, focus on smooth, relaxed movement rather than trying to force extra range of motion. Once 40 seconds are complete, slowly return to the center. That's your first stretch finished, and you've already started preparing the muscles surrounding your pelvic floor for the exercises that follow. Now let's move on to the second stretch, commonly known as the cobra stretch. This exercise helps lengthen the muscles across the front of your body, while encouraging mobility through the abdomen, pelvis, and lower back. If getting down onto the floor isn't comfortable for you, don't worry. Many people perform these stretches on a firm bed instead, which can make the transitions much easier while still allowing you to benefit from the movement. Lie comfortably on your stomach, with your feet resting about shoulder width apart behind you. Place both hands beneath or slightly in front of your shoulders so you're ready to gently lift your upper body. Before you begin, remember that this is not about pushing yourself as high as possible. Instead, the goal is to create a comfortable stretch while maintaining steady breathing. Slowly press through your hands and begin lifting your chest away from the floor. Allow the movement to happen gradually without any sudden force. As you rise, keep your pelvis gently connected to the surface beneath you. This helps direct the stretch toward the lower abdominal region rather than placing unnecessary stress on the lower back. Many people find it helpful to lift their gaze slightly toward the ceiling, because doing so naturally encourages the chest to open a little more. As you hold the position, pay attention to the area just below your belly button. That's often where you'll begin feeling the stretch most clearly. If the position feels comfortable, you can slowly press a little higher while still keeping the movement completely pain-free. Throughout the exercise, continue taking slow, even breaths. Your body may naturally want to hold its breath, especially if you're not used to stretching this area, but relaxed breathing allows the muscles to soften and makes the stretch far more effective. Continue holding the position while checking in with your body every few seconds. There should be a feeling of lengthening, never sharp discomfort. As the stretch continues, you may notice the front of your abdomen gradually relaxing while the hips become less restricted. Once your 40 seconds are complete, gently lower yourself back down with control instead of dropping quickly onto the floor. After completing the cobra stretch, take a moment to notice how your midsection feels. If your daily routine involves long hours of sitting, there's a good chance your abdominal muscles and core have been under constant tension without you realizing it. These muscles work closely with the pelvic floor, so improving their mobility may also support better movement throughout the entire region. Before moving on, I want to remind you that every body is different. These exercises are intended for general educational purposes and may not be appropriate for everyone. If any movement causes pain, or you have an existing medical condition, it's important to speak with your healthcare professional before continuing. Stretching should always leave you feeling more comfortable, never worse. In the next part, we'll continue warming up the hips and pelvic floor with another highly effective movement that helps improve flexibility through the groin while preparing your body for the deeper stretches that come later in the routine. Now that your hips and the front of your body have started to loosen up, it's time to continue building that mobility with another movement that targets the groin, inner thighs, and pelvic region from a different angle. These next stretches work together like a progression. Each one prepares your body for the following exercise, making it easier to move comfortably while gradually increasing flexibility without forcing anything. Remember, the goal is never to stretch as far as possible. The goal is to improve movement quality while encouraging better circulation throughout the muscles that support pelvic health. If you've been following along, you may already notice a gentle warmth developing around your hips or lower abdomen. That's exactly what we want because healthy movement encourages healthy blood flow. Let's continue by moving onto your back for the next exercise. Lie comfortably on your back and, if it feels better for your neck, place a small pillow beneath your head for support. This position allows your body to relax while your hips do most of the work. Bring both knees toward your chest and wrap your hands around the outside of your knees. This next movement is smooth, controlled, and almost feels like drawing circles with your legs. Imagine you're gently stirring a large pot. Slowly guide your knees outward, then down, around, and back toward your chest before repeating the same circular motion again. Your hands are doing most of the work, while your legs simply follow the movement. Keep breathing steadily through your nose and slowly exhale through your mouth. Avoid rushing each repetition because slower circles allow the muscles around the hip joints to gradually release tension. As your knees move outward, pay attention to the stretch developing through your inner thighs and groin. You should feel those muscles lengthening comfortably without any sharp discomfort. Continue making smooth circles for the full 40 seconds. With every rotation, your hips may begin to relax a little more, allowing your knees to travel slightly farther apart than they could at the beginning. There's no need to force extra movement. Let your flexibility improve naturally as the tissues warm up. If you notice that your breathing becomes shallow, slow everything down again. Relaxed breathing and controlled movement always produce better results than trying to stretch aggressively. As the final few seconds approach, continue maintaining those large, comfortable circles while keeping your shoulders relaxed against the floor. When the timer reaches 40 seconds, gently return your knees toward your chest and pause for a moment. You've now completed another important step in preparing the muscles that support pelvic floor function. Without changing your position, we're going to move directly into the next stretch. Staying on your back helps your body remain relaxed while allowing you to focus entirely on opening the hips a little further. Keep your pillow beneath your head if you're using one. Bring both knees back toward your chest, and this time, place your hands over the front of your knees instead of around the outside. From here, slowly begin guiding your knees apart as wide as your body comfortably allows. Remember, wider does not always mean better. The stretch should feel deep but comfortable. There should never be any sharp pain. Once you're in position, begin the 40-second hold. Continue taking slow, deep breaths. Every inhale helps prepare the muscles, and every slow exhale encourages them to relax just a little more. Many people notice that as they continue breathing, the hips naturally become less restricted without any extra effort. If that happens, you can gently guide your knees a little farther apart, but only if your body allows it comfortably. Never force the movement. Listen carefully to what your body is telling you. While holding this position, you should feel a broad stretch across the groin and inner thighs. These muscles are closely connected with how the hips move and how comfortably the pelvic floor functions during daily activities. If your arms begin working a little harder while holding your knees apart, that's completely normal. You're using your upper body to assist the stretch, while allowing your lower body to stay as relaxed as possible. Continue breathing slowly. Resist the temptation to hold your breath, because doing so often creates unnecessary muscle tension. Instead, let every exhale soften the stretch a little more. As the final seconds count down, maintain steady breathing and focus on relaxing the muscles instead of fighting against them. Once the 40 seconds are complete, slowly guide your knees back together and allow your legs to rest comfortably for a few moments. At this stage of the routine, you've already completed several movements that gradually improve mobility around the hips, inner thighs, and lower abdominal region. These stretches may appear simple, but together they create an effective warm-up for the deeper movement that comes next. If you've been paying attention to your body, you may notice a light tingling sensation around the groin, hips, or lower abdomen. In most cases, that's simply a sign that circulation has increased and the muscles have become more active than they were before you started. That's exactly why we build this routine, step by step, instead of jumping straight into the most challenging position. Preparing the muscles first not only makes the final stretch more comfortable, but also reduces unnecessary strain on the joints and surrounding tissues. Before we continue, take a few normal breaths and allow your body to relax. In the next part, we'll move into the deepest stretch of this routine, one that requires a little more flexibility, but can be modified easily if your body isn't ready for the full position just yet. You've done an excellent job preparing your body up to this point, and that's important because the next stretch is the most demanding one in this entire routine. Don't worry if you can't perform it perfectly the first time. Flexibility develops gradually, not overnight. The purpose of this exercise isn't to force your body into an uncomfortable position. It's to gently improve mobility throughout the hips, inner thighs, and pelvic floor, while encouraging healthy blood flow to the surrounding muscles. If you follow the previous stretches, you may already feel a little warmth or tingling around your hips, groin, or lower abdominal area. That's completely normal for many people, and often reflects that these muscles are becoming more active after spending much of the day sitting or moving very little. Now we're ready to safely progress into the final stretch of the routine. Before you attempt the movement, I want you to watch the setup carefully in your mind, and then move into position slowly. Lie comfortably on your back once again, with your head supported if needed. Bring both legs up toward the ceiling, and bend your knees so your hips and knees are comfortably flexed. From here, slide your arms between your legs so they come inside your knees. Reach toward the outside edges of your feet and gently wrap your hands around them. There's absolutely no need to rush into this position. Most people find that getting into the stretch is actually the hardest part. Take your time and allow your body to settle naturally. Once you have a comfortable grip on your feet, gently allow your knees to move farther apart. As you do this, keep your lower back relaxed against the surface beneath you instead of tensing your entire body. You should begin feeling a deep but comfortable stretch along the inner thighs, around the groin, and through the muscles of the pelvic region. Every person will feel this stretch a little differently, and that's perfectly normal because flexibility varies from one individual to another. Now that you're in position, begin your 40-second hold. Continue breathing slowly and evenly. This is probably the moment where your body wants to tighten up or hold its breath without you even realizing it. Resist that urge. Smooth breathing helps your muscles relax and allows the stretch to become much more comfortable over time. Keep your feet pointing upward so the soles remain directed toward the ceiling rather than turning inward or outward excessively. Your knees should stay comfortably wide, roughly matching the position of your feet. There is no prize for forcing your knees farther apart than your body is ready for. Instead, Allow gravity and gentle breathing to gradually do the work. If you find that you simply cannot hold this position comfortably, that's completely okay. Rather than straining, return to the previous knees to chest stretch that we practiced earlier and remain there for the same amount of time. Building flexibility is a process, and respecting your current limits is one of the smartest things you can do. Progress comes from consistency, not from pushing through discomfort. As you continue holding the position, pay attention to how your body changes over the course of those 40 seconds. Many people notice that after 20 or 30 seconds, the hips begin relaxing naturally. If that happens, you can gently use your arms to guide your feet slightly closer toward the floor while keeping your knees comfortably apart. This should create a deeper stretch throughout the pelvic floor and inner thigh muscles without creating pain. Again, the key word here is gentle. Every movement should feel controlled and comfortable. If you notice any pinching, sharp pain, numbness, or discomfort that doesn't feel like a normal stretch, reduce the intensity immediately or come out of the position altogether. Stretching should challenge your flexibility, but it should never create injury. Continue taking slow breaths as the final seconds count down. With each exhale, allow your shoulders, hips, and thighs to soften just a little more. When the timer reaches 40 seconds, slowly release your feet, guide your knees back together, and place both feet comfortably on the floor. Take a few moments to simply notice how your body feels before standing up. Now you've completed all 5 stretches in this routine. Together, these movements help improve flexibility around the hips, groin, lower abdomen, and pelvic floor, while encouraging healthier movement and circulation in areas that often become stiff after years of prolonged sitting or inactivity. Remember, these exercises aren't designed to create overnight changes. Instead, they provide your body with regular movement that may help support pelvic floor function over time when combined with healthy daily habits. Consistency will always produce better results than intensity. Even spending just a few minutes each morning, each evening, or both can gradually improve mobility and make these stretches feel easier week after week. The more regularly you perform them, with good technique and relaxed breathing, the more comfortable your body is likely to become. In the next part, we'll discuss how to incorporate this routine into your daily schedule, why consistency matters so much for long-term pelvic health, and the additional steps you should take to better understand the underlying cause of symptoms such as weaker erections or bladder leakage. Now that you understand the complete stretching sequence, let's talk about how to make these movements part of your normal routine and why that consistency is what truly creates progress. Many people make the mistake of looking for one quick solution when they notice changes in their body. They want a single exercise, a single technique, or a single day where everything suddenly improves. But when it comes to mobility, circulation, and muscle function, the body responds best to small actions repeated consistently over time. Think about these stretches as a way of reminding your body how it is supposed to move. If your hips have been tight for years because of sitting, limited activity, or daily habits, it makes sense that they may need regular attention before you notice meaningful improvements. You can add this routine to your morning schedule, your evening routine before bed, or even both if it feels comfortable for your body. The most important thing is finding a time that you can actually maintain. A 5-minute routine that you perform regularly is far more valuable than a longer routine that you only complete once in a while. Your muscles, joints, and connective tissues respond through repetition. Every time you perform these movements with proper technique, you are encouraging your body to maintain better flexibility and movement patterns. For many men, especially those who spend several hours sitting every day, the hips and pelvic area can become areas that receive very little attention. We often train the muscles we can see, such as the chest, arms, or legs, but we sometimes forget about the smaller muscles and structures that support important daily functions. The pelvic floor is a group of muscles that plays a major role in bladder control, stability, and sexual function. Like every other muscle group in your body, it needs proper movement, strength, and coordination to perform at its best. However, it's also important to understand that stretching is only one piece of the bigger picture. While improving flexibility around the hips and pelvic region can be beneficial, Symptoms like changes in erection quality or urine leakage can have many different causes. Sometimes these changes may be related to muscle function, but they can also be connected to circulation, hormones, lifestyle factors, stress levels, medications, or other health conditions. This is why paying attention to your overall health is so important. Your body is connected, and one area often influences another. If you've been experiencing ongoing changes with bladder control or sexual health, don't simply ignore those signs and hope they disappear. Your body communicates with you through symptoms, and those symptoms can provide valuable information. One of the best decisions you can make is speaking with a qualified healthcare professional who can help identify the possible reason behind what you're experiencing. A proper evaluation can give you a clearer understanding of what is happening and what steps may be most helpful for your specific situation. I also encourage men to stay proactive about their health instead of waiting until a problem becomes difficult to manage. Regular checkups, routine blood work, staying active, maintaining a balanced diet, managing stress, and getting enough quality sleep all play important roles in supporting healthy aging. Sometimes, the smallest improvements in daily habits create the biggest long-term benefits. You don't have to completely change your entire lifestyle overnight. Focus on the areas where you have control and build from there. Remember, your health should not control your life. Instead, your daily choices should help you take control of your health. Every positive action you take, whether it's moving more, improving flexibility, eating better, or simply becoming more aware of your body, is a step in the right direction. Many men struggle silently with these issues because they feel uncomfortable talking about them, but these are common concerns that deserve attention and proper care. The reason I create educational content like this is because I want more men to understand that they have options. Aging does not mean you stop caring about your body. It does not mean you simply accept discomfort, reduced mobility, or changes in your quality of life without taking action. There are practical steps you can take to support your health, and sometimes those steps begin with something as simple as dedicating a few minutes each day to movement. So take this routine, try it at your own pace, and pay attention to how your body responds. Be patient with yourself because flexibility and strength develop gradually. Some people may notice changes quickly, while others may need more time before they feel a difference. The important thing is staying consistent and making choices that support your long-term well-being. Before finishing this routine, I want to remind you again that these exercises are meant for general education and are not a replacement for personalized medical advice. If you have pain, unusual symptoms, or concerns about your health, always speak with a medical professional who understands your individual situation. The goal is not just to perform a stretch. The goal is to build a healthier relationship with your body and understand what it needs. In the final part, we'll wrap everything together, review the biggest takeaways from this routine, and discuss the importance of continuing your journey toward better men's health with patience, consistency, and the right support.